We will tell you something about HIV, and we will tell you about how you would get infected. It's important to have the basic facts. We will also cover how the preventive work regarding these questions is in Sweden, is organized, and so on. We'll talk something about sexual behavior. In the end, we will have some time for discussion, questions, reflections. So, very welcome, all of you.
And for you, if you don't know what RFSU stands for, it's the Swedish Association for Sexuality Education. It's a member of IPPF, if you know IPPF, International Planned Parenthood Federation, with members in all countries around the world, I think. I also would like to say that my English is not that good. I'm not used to make lectures in English, so if you do not understand anything, just raise your hand, then I try to explain what I mean. And I suppose I'm going to ask for help sometimes, so get used to it.
But that goes for me too. I'm not that used to talking in English. And something about the student health services, which I come from. It's over at Studenthälsan, and it's for all students at Malmö University. We have social counselors and a nurse and midwife. So that's we'll have websites in the end, so you can write it down if you want to have more information. So I'll move on. Well, this is HIV actually. What of it is it? It's the green dots, the beautiful ones. HIV is a virus. We have it written out here, human immunodeficiency virus. And this will target and destroy specific blood cells when it's infecting a person. And those blood cells are crucial to help the person fight diseases. It's the immune system. If you would get infected by HIV, the first symptoms would look like the flu, and you would maybe have it for 1 or 2 weeks. But not all infected have the symptoms. So you could go for several years having HIV not knowing about it. Meanwhile, if you would have it and not get diagnosed, the HIV virus would grow in your body and take over more of these white blood cells and affect the immune system over time. And if you would have HIV infection, that would be allowed to progress for a long time without treatment. This could develop AIDS later on. And that's a deadly disease. HIV is not a deadly disease. It's when you develop AIDS that it becomes deadly. So, you probably know this. There is no cure for it, HIV or AIDS. But there is effective treatment that would slow the progress of the infection. It would only also enhance the immune system. So you could live with HIV for a very long time. We don't know how long time today, because we have pretty new medicines working very good to slow the progress down. So we don't actually know for how long time you could live with it. Probably the rest of your life.
The rest of your life.
Yeah. Okay. Probably a long life. Well, if there would be someone infected with HIV, it's really of great importance that you would have regular contact with the doctor, and the doctor could monitor the progress of the infection, and he or she could also ordinate suitable treatment. Here in Sweden, all testing and treatment for HIV is for free. It's really regulated by law, and I think that's something very good and important. Well, how would you know then if you have a risk of being infected? Well, you should think about your sexual activities. Were they sometimes unprotected? Well, HIV is spread through exchange of bodily fluids. It's also spread via the contact with blood and mucous membranes, and also by wounds, so blood to blood. And it's also transmitted via the sharing of needles or syringes.